Welcome to Ulosca channel. Access all nursing practice questions. HESI-NSG mental health nursing practice questions with answers.
Question 1. A client is pacing and wringing their hands, stating, "I don't know what to do." What is the nurse's priority response? A. Why don't you sit down and relax? B. Let's take some deep breaths together. C. Everything will be okay. D. You shouldn't worry so much. Which one is the correct answer? The correct answer is B. Let's take some deep breaths together. Explanation. The client is demonstrating signs of escalating anxiety. Guiding the client through deep breathing helps reduce physiological symptoms and provides grounding. Other responses dismiss or invalidate the client's feelings. Question 2. Which behavior indicates a positive outcome of group therapy for a client with depression? A. Remaining silent throughout the session. B. Giving advice to other group members. C. Encouraging a peer who is expressing sadness. D. Discussing problems only with a nurse. Which one is the correct answer? The correct answer is C. Encouraging a peer who is expressing sadness. Explanation. Actively engaging with peers and providing support demonstrates improved social interaction and emotional insight, key goals in group therapy for depression. Question 3. A client tells a nurse, "I am worthless and better off dead." What is the nurse's priority action? A. Document the client's statement in a chart. B. Notify the healthcare provider. C. Ask the client if they have a plan to harm themselves. D. Reassure the client that things will get better. Which one is the correct answer? The correct answer is C. Ask the client if they have a plan to harm themselves. Explanation. The priority is safety. Directly assessing for suicide intent and plan is essential in evaluating risk and guiding immediate interventions. Question 4. A client with schizophrenia says, "The voices are telling me to hurt someone." What should the nurse do first? A. Administer PRN antipsychotic medication. B. Tell the client to ignore the voices. C. Ask the client if they intend to act on the voices. D. Redirect the client to a group activity. Which one is the correct answer? The correct answer is C. Ask the client if they intend to act on the voices. Explanation. Assessing whether the client intends to act on command hallucinations determines risk to others and helps guide necessary interventions to ensure safety. Question 5. Which therapeutic communication technique is most appropriate when a client with anxiety says, "I can't focus on anything"? A. Why do you feel that way? B. Calm down and try to relax. C. Can you tell me what's happening right now? D. Everything will be all right. Which one is the correct answer? The correct answer is C. Can you tell me what's happening right now? Explanation. Focusing the client on the present moment helps bring awareness to current triggers and opens a path for calming and grounding. It avoids dismissing the client's anxiety. Question 6. A nurse is caring for a client with bipolar disorder during a manic episode. What is the best nursing action? A. Encourage group participation. B. Set firm limits on behavior. C. Offer detailed explanations. D. Provide open-ended choices. Which one is the correct answer? The correct answer is B. Set firm limits on behavior. Explanation. During manic episodes, clients may have poor impulse control and be at risk for unsafe behaviors. Setting consistent and firm limits helps maintain safety and structure. Question 7. A client with generalized anxiety disorder is prescribed buspirone. Which information should the nurse include in teaching? A. This medication is addictive. B. It may take 2 to 3 weeks to become effective. C. You can take this medication as needed for anxiety attacks. D. Avoid grapefruit while taking this medication. Which one is the correct answer? The correct answer is B. It may take 2 to 3 weeks to become effective. Explanation. Buspirone is a non-benzodiazepine anxiolytic that is not useful for acute anxiety. Its effectiveness takes several weeks, so patient education on delayed onset is essential. Question 8. Which statement by the nurse reflects the use of reflection in therapeutic communication? A. You said you feel angry about what happened. B. Let's explore that more. C. I understand how you feel. D. Why do you feel that way? Which one is the correct answer? The correct answer is A. You said you feel angry about what happened. Explanation. Reflection involves restating what the client has expressed to encourage deeper communication and show understanding without judgment or assumptions. Question 9. That a client with PTSD avoids social situations and startles easily. What is the most appropriate nursing diagnosis? A. Ineffective coping. B. Risk for violence. C. Impaired memory. D. Chronic confusion. Which one is the correct answer? The correct answer is A. Ineffective coping. Explanation. Avoidance and hyperarousal are key diagnostic criteria of PTSD. Ineffective coping reflects the client's difficulty in managing stress related to trauma. Question 10. Which nursing intervention is appropriate for a client experiencing auditory hallucinations? A. Confront the hallucinations directly. B. Tell the client the voices are not real. C. Ask what the voices are saying. D. Isolate the client from others. Which one is the correct answer? The correct answer is C. Ask what the voices are saying. Explanation. Asking about the content of hallucinations helps assess the client's risk to self or others. It builds trust without validating or challenging the hallucinations directly.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.